Trevor, tell us about melatonin. I think melatonin is probably pretty well known to most people, but tell us about, some more details of it and dosing of melatonin specifically.
Yeah. So this topic seems to have a lot of energy behind it in the last couple of years. And it's I kind of view it as two different pillars of melatonin supplementation and why. So there's many reasons why melatonin is beneficial to the human body. But what I've noticed, at least, is that there's two types of clinicians, or there's two types of reasons why a patient or a consumer would use melatonin. The obvious, which is sleep and circadian rhythm, and the less obvious and the more new progressive is immune function, right? Yeah. And so this became, I think, in the mainstream during COVID, which was a lot of people were using melatonin as an antioxidant, and also because of people were struggling with sleep challenges because you're indoors all day, so you've disrupted your circadian rhythm. Indirectly, improving sleep improves your immune system, but directly, melatonin is produced by the pineal gland in our body, and the pineal gland is a precursor to the thymus. And the T of the thymus is how we create the term T cells, which is adaptive immune cells. So we only have B cells and T cells, and they're the smart immune cells. And those are critical for cancer. Those are critical for recognizing viruses and overcoming them, and for chronic infections. And so melatonin has come up a lot in the immune function world because it's a ingredient hormone that is used to stimulate the thymus and the T cell function category. So yes, powerful antioxidant, raises glutathione levels, very good for supportive chronic immunity. And for sleep, there's a couple things to think about here. So yes, melatonin can make you groggy. Yes, it can suppress cortisol in the morning, which is a good thing, which is why often people don't feel inflamed or right. in a lot of pain. But it's important to understand doses of 1 milligram can be effective. We use a sublingual in our melatonin, so you bypass gut delivery. You go straight from under the tongue, dissolve to the bloodstream. So you feel it a lot faster. Up to 5 milligrams, which is a pretty substantial dose, should really help people sleep. And you will notice an immune benefit up to 10 milligrams, which would be kind of getting near the upper range for sleep support. And I'll just throw this out there. This is not me, but I've noticed clinicians using up to 100 to 200 milligrams for viral and chronic immunity and antioxidant support. So I think we're just starting to see what melatonin can do, and especially when delivered in different ratios and different forms and different doses. But I think simply starting for sleep with 1 to 5 milligrams per night to focus on staying asleep, falling asleep earlier, and resetting your circadian rhythm, especially with jet lag and traveling, and then up to 10 milligrams for someone who really wants to get into a deeper sleep is a great start.
Well, I'll say it over and over again about the importance of sleep on that subject is that, sleep trumps everything. Sleep trumps food. Sleep trumps exercise. If you want to stay healthy, you have to sleep. Right. And you speak of it, circadian rhythm wise. That I believe, and I've actually had many discussions with people on this, is that we're made to sleep at night and work during the day, or be active during the day. So that's what the circadian rhythm is, and that's how we recover the best. So,
amen.
Yeah. So thank you, Trevor, for that. As always, it's a super pleasure. I love your wisdom and knowledge. Thank you for educating us.
Thank you, Shawn.